Ruth, are you there? Are you available?
Yes, I'm ready to go. Thank you very much. I'll
All
share my
right.
slide.
Okay. If you share your slides, in the meantime, if you share, if you also um, show your video, and maybe I can just introduce you. Dr. Ruth Owusu-Antwi is a fellow of the Ghana College of Physicians and Surgeons and a senior lecturer at the School of Medical Science at the Kwame Nkrumah University of Science and Technology. She practices in Komfo Anakoye Teaching Hospital at the senior specialist level, and she is the immediate past president of the Psychiatry unit. She is medical director at Recovery Pathways, a renowned private practice that specializes in outpatients and inpatient mental health care and other and offers employee assistance programs to several institutions. She has won many awards in the field of practice, including 2019 International Fellow of the Association of Women Psychiatrists in San Francisco, 2005 National Prestigious Millennium Excellence Awards, and she's working on women's mental health. She's immediate past president of the Ghana Association, and she has uh, been very important in the Psychiatric Association of Ghana. She has over 30 publications in peer-reviewed journals and published book chapters. She's a Christian married and has many biological adopted children. And her talk today will be on the prevalence of gender-based violence and factors associated with help seeking among university students in sub-Saharan Africa. If you put your video on, are you willing to do that, or are you on? Can you
My
un?
video is already on.
All right, okay, that's perfect. Okay, so yeah, Ruth, thanks for coming, and thanks for starting now. Okay.
Great. Thank you very much. It's nice meeting you all. And well done for putting this program together, especially Professor Rainer and the rest of the team. I am grateful for this opportunity to talk about some of the work I have been doing on gender-based violence. Like my name was mentioned, I'm Ruth Owusu-Antwi. I come from Ghana, West Africa. So I'll be talking about the prevalence of gender-based violence and factors associated with help seeking among university students in sub-Saharan Africa. So I work with a group of researchers. We call ourselves Sub-Saharan African University Gender-Based Violence Prevention and Response Network, SUBVET for short. And the group entails people from different countries. Now we have over 15 countries on board representing different universities in different countries, mainly in sub-Saharan Africa. The group has been in existence since about 2016, but I joined in 2015, and our focus has been on gender-based violence, especially in the university. Our latest work, which I led on that particular project, was looking at the prevalence of gender-based violence and factors associated with health seeking among university students in sub-Saharan Africa. And I would delve more into that as I go into my presentation. Our work was published in the Women's Health Journal. This particular work. So by way of introduction, we know WHO has defined gender to refer to characteristics of women, men, girls, and boys that are socially constructed. This include norms, behaviors, roles associated with being a woman, man, girl, or boy, as well as relationships with others. And as a social construct, gender varies from society to society and can even change over time. Additionally, gender produces inequalities that intersect with other social and economic inequalities. WHO has defined gender-based violence, therefore, as being a major public health issue worldwide and defined it as violation of human rights driven by inequalities between men and women in society. We know the effects of gender-based violence, but primarily it potentially has significant long-lasting physical and mental impacts, including injuries, unintended pregnancies and pregnancy complications, sexually transmitted infections, HIV, depression, and post-traumatic stress in survivors. Interestingly, gender-based violence is one of the public health issues that has been seen to occur everywhere in the world. There is no part of this world that issue of gender-based violence is not a concern. So currently, gender-based violence is a global public health problem occurring across geographical and cultural contexts. Evidence from across the globe suggests that only 5% of women and girls will suffer from a form of intimate partner violence or non-partner physical or sexual violence in their lifetime. That is more than 1 out of every 4 girls. 1 out of every 4 girls. That is a staggering and worrying statistics there. According to the same evidence, 33% of women, specifically in sub-Saharan Africa, are expected to experience some form of violence at least once in their lifetime. And so when you come to sub-Saharan Africa, more women are predisposed or at risk of experiencing some form of gender-based violence. About 1 out of every 3 women. And currently, the sub-Saharan region has one of the highest prevalence rates of lifetime intimate partner violence worldwide. So this is a global map showing regional prevalence rate of intimate partner violence, which was put together by WHO. This was a map put together in 2010. And we realized that every part of the globe has some percentages ranging from 37% through to 29%, 24%, 23%. So every part of this will tend to suffer some form of gender-based violence. Now, gender-based violence comes in several forms, and it includes intimate partner violence, which can be physical or psychological. It includes sexual violence, and it includes stalking. Gender-based violence has resulted in a lot of negative consequences and numerous aspects of health and wellness. And some of them are the fact that GBV results in acute and chronic conditions or health conditions. It can lead to chronic pain, it can lead to digestive problems, and it can even lead to cardiovascular diseases. Again, GBV can result in psychological health issues, resulting in disorders like major depression, anxiety disorders like post-traumatic stress disorders, etc. It also leads to complications in the area of reproductive health. We have had specific complications like maternal miscarriage, sexually transmitted infections, etc. Additionally, individuals who experience gender-based violence can suffer from economic and social outcome. And the ultimate complication and consequence of gender-based violence is suicide and eventually death. What are the well-known risk factors for gender-based violence? Low self-esteem, low income and unemployment, low academic achievement, and that is one of the reasons why we targeted our study among the academic institutions. We realized that if we're able to target one of these risk factors, it may be one of the ways to reduce the incidence and the prevalence of gender-based violence. Young age is a risk factor. aggressive or delinquent behavior as a youth, substance use, depression, antisocial personality disorders, desires for power and control in relationships, history of experiencing poor parenting as a child, are all known risk factors for gender-based violence. And let's look at some specific factors, risk factors for gender-based violence. When you look at relationship factors, marital conflicts, fights, tension, and other struggles are a major risk factor. Marital instability, like divorces, separation, economic stress, unhealthy family relationships and interaction are notable relationship risk factors for gender-based violence. When we group the risk factors into community factors, we have poverty that is usually associated with overcrowding, low social capital, lack of institutions, relationships, and norms that shape communities' social interaction is a risk factor, and weak community sanctions against intimate partner violence or against gender-based violence. There are some neighbors who consistently hear beating in their next door neighbor's house. They constantly hear fighting or sometimes actually see and witness fights between couples or intimate partners, and they are unwilling to intervene because they think that it's not their business. When we continue to look on some of these things without caring, without concern, then as a community, we are perpetrating gender-based violence. There definitely are some cultural factors that have been linked to gender-based violence. We have, as Africans, our traditional gender norms, like women should stay at home, women should not enter the workforce, women should be submissive, and that men have the final say in families, and that it is men that make all the decisions in families, are very ingrained cultural factors that subtly promote gender-based violence. Now, zooming in into gender-based violence and university students, having said that gender-based violence is a global public concern, universities are not spared. Whilst research exists on gender-based violence and its associated help-seeking behavior among university students, there are few studies that have been done to assess the prevalence of gender-based violence, including experiences and barriers to help seeking within the sub-Saharan African university setting. So our study was unique in terms of the fact that it involved higher education participants. And we know that when people achieve some form of higher education, it has a unique characteristic that shape the individual's risk of gender-based violence. For instance, ideas of female inferiority on university campuses in itself exacerbates the power imbalances between women and men on campus. Simple positions like Students' Representative Council President, or what we call the SRC Council President, or student leadership positions, or student union leadership positions tend to go for men, or tend to be given to men more than women. And these are university campuses where we are shaping the lives of our students, our young men and women. And if at that point where proper education is supposed to take place, we have these cultural norms still entering, then we increase the vulnerability of the female students to gender-based violence later in their lives. And that is not all. On university campuses, we are very much aware of how gender-based violence is perpetrated by people in positions of authority and influence, how they exert influence over students, female students, such as the male faculty and university administrated in exchange of grades and etc. And so it's important that we focus on gender-based violence in university setting because it is widely recognized that education is one of the most effective strategies for reducing poverty and improving health in low and middle income countries. Universities have a duty to create a safe campus environment that foster students' learning. However, the gender-based violence in these university settings is undermining the ability of these institutions to uphold the right to education and to safeguard physical and mental integrity of our students. We found some campus level factors that put students at the university specifically at risk of gender-based violence. Some of these factors are the fact that these students are living independently for the first time and away from their parents, away from parental control. This is a gathering of young men and women, and so you can expect peer pressure. We realize that the lack of formal and informal parental control is also a unique risk factor. And then the normalization of substance abuse on campuses are all factors when combined with culture, normalizes sexual violence, accepts rape myth, and promotes hypermasculinity that can result in gender-based violence on campuses. Further, we further found out that a systematic review indicated that the exposure of students to gender-based violence when they are on campus has a negative impact on the students' educational path, and it affects their academic performance, it affects their attendance to lectures, and specifically results in high dropout rate, changes in the field of study, it results in academic disengagement, it results in changing in educational attitudes and satisfaction, and it results in changes in academic climate. And so considering all these adverse effects of gender-based violence in university setting, receiving formal or informal sources informal sources of help is thought to be essential to mitigating the effects of gender-based violence and improving health outcomes and well-being. Research has shown that in African countries, the rate of women who seek help after intimate partner violence is very low. For example, there was a cross-sectional analysis in sub-Saharan Africa that found out that among women who experience IPV in the region, only 39%, like about a third, have sought some form of help, with some countries having a prevalence of as low as 20% of these women seeking help. So what did we do? The surveyed group decided to examine the prevalence of gender-based victimization and help-seeking behaviors of university students from universities across sub-Saharan Africa. We involved about 6 universities, and we sought to understand the experiences and barriers to help-seeking, as well as some demographic factors that were associated with informal and formal help seeking. And we sought to find out how we can help university responses to support student survivors of gender-based violence. So specifically, we sought to do 3 major things: to identify the prevalence of gender-based victimization among students since entering the university. Secondly, we sought to describe help-seeking behaviors and barriers among students who self-identified as having experienced gender-based violence. And then lastly, we sought to examine some demographic factors like age, gender, sexual orientation, religion, university, or country that were associated with formal or informal health seeking. And so we designed our study by using an online cross-sectional survey study, and this was administered to universities online between the months of July to October 2023, initially at 9 participating universities, but due to data inadequacies, we involved only 6 countries in the data analysis. And so in the analysis, descriptive statistics were used to describe the types of violence among students. We took data from 2,249 students, and we used several other statistical analysis to examine the demographic factors associated with informal health-seeking behavior among the sample of gender-based violence. So these were some of our findings. A total of 63.7% of students were reported stalking victimization. 18% of our students, of our sample students, reported sexual violence. 30%, almost 31% reported physical violence, and then 64.9% reported emotional victimization among our sample size. When we looked at the results on the help-seeking behavior, we realized that majority, up to 78% of survivors who sought informal help, they sought it from friends, partners, family members, and religious leaders. And approximately a third, that is 29.5% of our students, sought help from formal sources like the university administrators, healthcare professionals, or the police. But many students reported barriers to seeking support for gender-based violence. And the most common barrier that included the students, included the student not knowing where to get help at all. And that accounted for about 32%. And then the other barrier was that they did not believe their situation was as bad or as serious enough that warranted help. And that accounted for 28% of the barrier. And then the third common barrier was the fear that others will know that they have become victims or they are survivors of gender-based violence. They feared being judged. They feared the stigma that goes with gender-based violence. And that accounted for 34% of the barriers to seeking help. And so some of the conclusions that came out of our study show that the prevalence of physical violence among our sample was 30.9%, out of which 18 was for sexual violence, 64 was for psychological violence, and 63 was for stalking. And then among the sample who had experienced gender-based violence, most of them, up to 78% of them, preferred to seek the informal help, which were basically from friends, partners, or family members. And just 1/3 of them decided to seek formal help. And again, our results indicated that the university country was associated with formal help seeking. That is, specifically universities or students who were universities in Ghana and Rwanda were over twice as likely to seek formal help than students in the other countries. And then, while differences by gender were noted also in the formal seeking, help-seeking behavior. Still, part of our conclusion on this study tells us that gender-based violence is a significant public health issue, specifically among university students in sub-Saharan Africa, and that most sub-Saharan African university students are seeking informal support after experiencing gender-based violence due to commonly perceived barriers as not knowing where to go, not believing their situation is serious enough, and it means that education on gender-based violence is very low and poor among our universities, and also people were concerned about stigma when they seek formal help. And as such, efforts to address gender-based violence within university settings in sub-Saharan Africa should be coordinated to maximize opportunities to share lessons learned, best practices, and the expertise and disciplinary perspectives of diverse administrators, faculties, and students in prevention development. I would end on this note by saying that domestic violence or gender-based violence typically recurs and progressively escalates. The ultimate result of domestic violence may be death from suicide or homicide. We should not keep quiet. We should empower our patients, and we should by all means educate them and show them where to seek help. Thank you very much for your attention, and these are some of selected references to my presentation. Thank you.
Yeah, thanks a lot for this very interesting talk. If there's questions, I think if there's some in the chat, I hope you can hear me. Well, you can't see me, so okay. Right, okay, sorry. Yeah, thanks for this very interesting talk, and I'd like to ask for questions, but if there's nothing at the moment, I would like to ask myself or ask you yourself, how does the current media, how does it influence the perception of violence? Because let's say in Great Britain we have more and more reports of stalking, and people are, media celebrities are presenting their cases. So that does it have a positive impact on the perception? And the other thing is, possibly stalking is something which gets worse under all these media. And so what's the current development? And so is there any, especially is there anything you have asked about these media influences of that?
We have not specifically studied the effect of media on gender-based violence like stalking, specifically in sub-Saharan Africa in our study, but I'm sure there are published studies out there that the more people get to report and speak about it, the more people get to know that these things are wrong. We realize from our study that people at the highest level of education, which is tertiary, did not think that there was, anything wrong with gender-based violence. They did not think that stalking was a problem. They did not think that emotional abuse was a problem enough to report. And that shows a low level of education among people who are expected to be the most highly educated in our institutions. And so some of the role the media can take up as they make these reportages is to take an opportunity to educate the populace that these things are wrong. People need to report. People don't have to keep quiet. They need to seek help as well. And it's one of the ways that will gradually lead to reducing the prevalence of gender-based violence. Thank you.
Yeah, so there, some people say you had a wonderful presentation, but there's also a couple of questions. Do you think medical doctors need training to recognize gender-based violence early?
Definitely. I, as a person, do a lot of courses among my colleagues to train them on how to recognize early gender-based violence. If you are in the consulting room, mostly a family physicians or the family doctors are usually the first point of call for people or who are survivors of gender-based violence. And we teach them most of the red flags. Sometimes people come just repeatedly with bodily pains or repeatedly with non-specific symptoms that laboratory investigations do not reveal any specific diagnosis. Sometimes a particular patient consistently come to the consulting room trying to cover up their physical injuries by wearing really broad sunglasses or wearing very thick makeup to cover their injuries, or sometimes wearing clothing right up to their neck so that their injuries on their neck will be covered and all of that. And you need to have a high index of suspicion when some of these non-specific complaints from a particular person keeps coming, or people come to the consulting room wearing sophisticated clothing and makeup probably in an attempt to cover their physical injuries. And so these are things that we need to consistently teach doctors to pick up early, because it is very difficult for survivors to willingly report issues of gender-based violence. And it's important that doctors learn to initiate that conversation and make it comfortable for survivors to freely talk about the troubles and the pain they are going through and to seek help.
I think there's a question which relates to that from Dr. Basu. She has, or he has encountered patients who are backing out at the moment and when they suggest any more actions. So how do you really persuade? So what is your approach to persuade people to report?
What I have done in my country and have found to be very helpful, I don't have the statistics readily available, but there is an obvious measure of how this particular approach has helped. So what we put together, first of all, we observed this very same problem back home. We realized that the person starts talking about their problems, and then you tell them, if for instance it is a sexual abuse, you tell them go to the police and get a police report, or go and see the obstetrician gynecologist to confirm that, to be examined, to confirm that there was actually a rape, go and see the clinical psychologist. So this particular one patient who is already dealing with the trauma of the violence keep reliving their trauma by telling their story over and over again at different places to different specialists, and monies are collected from them, pay for this, and they become really exhausted. Most of them give up. So what we sought to do is what we decide to set up abuse clinic, survivors of abuse clinic. And these are clinics currently in two major cities in the country. We have one in the leading tertiary hospital in the country, Kolebu Teaching Hospital. And then the second one I set up myself at the second biggest teaching hospital where I work, which is the Konfanochi Teaching Hospital in Kumasi. So this Survivors of Abuse Clinic is a one-stop clinic that you would get all the support that you need for every kind of abuse, and we see both children and adults, and we have about 14 different specialists in the clinic. We get people referred to the clinic so that we book them for a specific date, so that based on the referrals we have gotten and the nature of the abuse, we get our team together. And so these 14 specialists entail a psychiatrist, a psychologist, an ethicist, a human rights lawyer, a police officer, or back home, we call them OWUSU group. We have an obstetrician gynecologist, we have an emergency physician, and we have an art therapist, several other professionals in that group. And when you come, you tell your story just once, and then it is moved across the various specialties that you will require their help. There are times that patient cannot pay for legal help. We have legal aid, which provide free legal support to our patients. And it has made it possible for people to follow through to getting help. So these are things or approaches that I recommend for people to put together at their setting.
Maybe a quick question. Is there any difference noted between IPV among people who are married or unmarried? So is there any differences which, interrelationship?
So IPV occurs across all forms of relationships, including the married, including the cohabiting, including the different kinds of relationships, whether homosexual or heterosexual. IPV exists almost equally across board. And so these are real things happening in all forms of relationships where love was supposed to be the focus, ending up in abuse.
Okay, I think there's someone, right, Monika Thakur. Do you want to ask a question?
Yes, sir. Actually, it is similar to the answer given by ma'am. So good evening, ma'am. My question was the difference. Basically, I have come across such patients where when a female is married, at that particular time, I have observed the stigma is slightly more. And since it's a social relationship where people know about it, so somehow, the sexual kind of violence and physical kind of violence, people either observe less, and when they observe it also, at that moment of time, people do not want to report it, and it goes in general unrecognized and then neglected further. So that was my question, whether any sort of stigma is observed in these kind of people, where maybe among married people it is more, or it is more among the people who are not, linked with any sort of relationship. Further, if I observe such patient in my clinic, and I know that this is a legal kind of issue, whether I should advise for them to seek legal help, or shall I be in my boundaries? What should I do? Because this not only happened with gender-based violence, but with multiple, kind of people. And this one particular patient, I have observed where she dropped the treatment the moment I recognized that the violence is involved, and it's a physical violence and it's a sexual violence as well. And unfortunately, she have taken treatment from 5 to 6 center before, and once I recognized that, post that, the partner of her, since she was dependent financially on him, she dropped out of the treatment. Otherwise, she was improving a lot. So, in that case scenario, what should we do? And what is your observation for that?
Yeah, thank you very much. Yeah, so when people are married or are in married relationships, the perceived stigma of gender-based violence is even higher, and it's been more difficult in my practice. I've realized that it's been more difficult for married people to seek help for the gender-based violence, mainly because of cultural and religious reasons. You don't know whether you are reporting to leave the marriage or you are concerned about the stigma that you went into a very bad marriage and all that. And mind you, it is not only women who are survivors of gender-based violence. There is some percentage of men who also are survivors, or who are also on the victim's side. And when they are in a married relationship, I have observed, you are rightly said so, that the stigma, the barrier of stigma in terms of seeking help is more. And then you asked whether when you meet a case in your clinic, is it your duty to report or not? And it's a big yes. I'm not sure your country's laws, but in my country, in Ghana, gender-based violence is an offense. And so for you to meet a case like that and not report, you are sort of seen to be aiding and abetting, or sought to be seen to helping a crime or an offense perpetrate. And so it is your duty to report. In my country, we have a specific unit within the police system that specifically handles gender-based violence. And what we have done in my country in terms of the survivors of abuse clinic makes it even easier for us. We just contact our police personnel on that clinic and then involve them directly from there. there. I have had people or victims who have pleaded that they don't want their husbands to be arrested and all that. And you can understand because they can't see how their partners or their husbands will be arrested, and then who will feed the family, who will feed the children and all of that. It becomes a very dicey situation, and that is why we seek to empower women also through education so that they don't have to depend on men. When there is poverty, gender-based violence thrive and worsen. Again, our Survivors of Abuse Clinic has made it easier for women who may not be well employed or who may not have enough financial strength to get some help, because all the help that we give at one standing is usually sponsored by well-meaning people. There are times that we have to move these women out of danger into halfway homes, and we have had volunteered doctors or doctor couples who have signed on to accommodating some of these survivors for a period up to 3 months, whilst both the individual couples get some counseling and get some professional support. And so we do not promote divorce, but our aim is that at some point in time, when your life is at risk, we need to remove you out of the danger so that you don't lose your life. And so we would recommend that you separate from your marital home and get some help. There are no national government halfway homes, and so we have had to use volunteer homes for that purpose. And so that is how we have been managing it back home.
Right. Okay. I think it's a very exciting discussion, and sadly we have to finish now.